Hello, my name is Harong Huang, and today I'll be presenting my proposal about the validation of photobiomodulation as a treatment option for diabetic retinopathy in vascular retinal organoids. Diabetic retinopathy, or DR, is a vascular disease that can cause vision loss in patients suffering from diabetes mellitus. Current treatment options for DR include laser photocoagulation and anti-VEGF medications. However, although effective, these methods show limitations. Thus, novel treatment alternatives for DR are also gaining interest nowadays. For example, researchers are evaluating the treatment of near-infrared light, or photobiomodulation, in DR in both preclinical and clinical settings. Current results suggest that PBM is effective in treating DR by improving mitochondrial function in photoreceptors and Mueller cells, which are key players in the protection of the blood-retina barrier. However, these positive results have yet to be definitively validated for the common clinical use of PBM in treating DR. One of the reasons why the use of PBM in treating DR has not been able to be definitively validated is because current preclinical studies often rely on models that do not accurately portray clinical DR in its vascular aspects. For example, organoids are great in vitro tools that portray their natural counterpart organs. Organoids have played a huge role in preclinical research for some time now, and using recent advances, researchers were even able to successfully develop retinal organoids that resemble many aspects of the real retina. However, the ability to incorporate vasculature has not been fully implemented in retinal organoids with high functionality and reproducibility. As a result, as DR is a vascular disease, the lack of organoids in portraying vasculature has limited preclinical DR research. This includes the validation of the positive effects of PBM on DR, and thus an accurate reproducible vasculature retinal model is urgently needed for the portrayal of DR, and the effects of PBM on DR must be validated using such a model. Considering this, the goal of the proposed research is to develop a vascular retinal model that can portray DR and thus validate the proposed positive effects of PBM on DR. To develop a vascular retinal organoid, the proposed study aims to direct the incorporation of mesodermal progenitor cells into a retinal organoid derived from human-induced pluripotent stem cells. And throughout development and post-development, the proposed study will characterize and assess the retinal organoids using methods such as H&E staining, immunofluorescence analysis, and TEM. To replicate DR in the developed vascular retinal organoids, the retinal organoids will be exposed to high glucose levels, and the growth factor environment will be manipulated. Moreover, oxidative stress and inflammatory stimulation will be induced by adding oxidative stress-inducing agents to the culture medium. Throughout the induction process, the organoids and various markers related to DR will be assessed using similar methods detailed previously. PBM will be performed at 660 nanometers or near-infrared light for 24 hours continuously for 4 days, 7 to 10 days after DR manipulation. Changes resulting from PBM will be observed using similar methods detailed previously and by following a protocol proposed by a different group of a published paper. There will be a focus on photoreceptors and Mueller cells, as PBM has been reported to improve mitochondrial function in them. To further validate the effects of PBM stimulation on vascular retinal organoids will be compared with PBM stimulation on animal models of DR. Specifically, a protocol proposed by a different group of a published paper will be referenced to produce streptozotocin-treated models and to stimulate long-term PBM on those animal models. The proposed technique of directing the incorporation of MPCs into retinal organoids may not be sufficient in producing a retinal organoid model that accurately incorporates vasculature for the portrayal of DR. If vascular vascularization is not developed, the proposed study will validate the effects of PBM on DR with retinal organoids lacking vascularization. As the retinal organoids developed in the proposed study will be cultured in basal media, including IGF-1, to ensure laminated structure and photoreceptor maturation, they may be sufficient to model DR with other factors and to observe PBM effects and thus provide some insight. The proposed retinal organoid may portray the retinal vasculature and the development of DR in the retina well, but it may fail to produce the suggested improvement of mitochondrial function in photoreceptors and Mueller cells with PBM on DR, due to its lack of incorporation of other complexities involving the mechanisms of PBM. In this case, the proposed study will observe and validate general PBM effects on other cells or players in the retinal organoid, such as cytokines. The proposed study aims to develop a vascular retinal organoid and to validate the proposed positive effects of PBM on DR using the developed model. As current models used for DR often fail to mimic important vascular aspects of the disease, in developing a vascular retinal organoid model, the proposed study will be able to greatly advance the field of DR research by especially allowing an unprecedented level of accurate treatment screening. Moreover, by using the developed vascular retinal organoid to validate the effects of PBM on DR that have been suggested by previous studies, the proposed study will be able to definitively suggest PBM as a safe and effective treatment for DR, aiding the fight to protect the health and well-being of DR patients all around the world. Thank you for listening.